Good morning, it's Dr. Garrett, and today I wanted to talk to you about some of the causes of a sore throat and which ones are the bad ones. So, in the back of the throat, let's talk about the anatomy. You will have tonsils. Now, if you've had them surgically removed, obviously you're not going to have tonsils. However, in a rare percentage of people, if you've had them surgically removed, they can grow back. But typically, these tonsils are lymphatic tissue. Now, sometimes they'll be flat, sometimes they'll be out extended a little bit, sometimes they'll be kissing where they're nearly touching. And we grade your tonsils. Now, of the tonsils, there could be holes in them. This is what we call crypts. Now, crypts aren't necessarily a good thing because that's just more areas for bacteria to get in there, set up residence, and invade the body. So what happens? You come in contact with the bacteria strep pyogenes. It sets up within the tonsils or within the crypts of the back of the throat, and it starts to grow. So what are some symptoms that you will have with strep? We go off something called the Centaur criteria for strep, and it is fever. So typically you will have a pretty decent fever, not 99, typically it's over 100. And then you will have a lack of a cough. Now, if you've got a cough, most of the times this is just postnasal drainage that's coming down that's causing that sore throat. You will have exudate. Exudate is when you look in the back of the throat on those tonsils and you will see white stuff. Now, that white stuff sometimes can be hard, like a tonsil stone, or it can be slimy, milky. It might even look kind of yellow and might have some pus to it. Now, there's always something called a peritonsillar abscess where it swells up really big. Usually you'll notice that the soft palate is involved and that your uvula will be shifted off to the side, and that's like having a giant boil on your tonsil. That's not a good thing. Now, the other thing that you'll have is adenopathy. Now, adenopathy is a term that describes swelling of the lymph nodes, and we will have anterior cervical adenopathy. So the front of the neck will have swollen lymph nodes down through here. So that's kind of our criteria for strep. Now, strep needs to be treated most of the times because if not, it can cause some heart issues like rheumatic heart disease or endocarditis. So most of the time, if your patient or if you have strep, we want to treat you with an antibiotic. We're typically using a gram-positive antibiotic, something like augmentin, amoxicillin, or azithromycin. Sometimes we'll do something like a cephalosporin, like Omnicef, that has a little bit wider coverage if we're not sure what the bacteria is. Now, when you go to the doctor, you'll get a strep test done. This is where they take a little swab. They knock the side of your tonsils a couple times, cause you to want to gag and puke in the office. And then they're going to put it in a little reagent and they're going to see if it turns the line a certain color that would indicate strep. Now, you may have all of the symptoms and it not be a strep bacteria. So what they do then is they culture it. They will send the swab off to the lab. They'll rub it on a petri dish that has a little bit of a gel agar on it, and they're going to grow it and see what grows. And then they can determine what medication will work best to help heal your infection of your throat. Now, again, strep pyogenes is the one that we worry the most about, but there are other things as well. And a peritonsillar abscess is something that we're super worried about. So if you start getting swelling of one tonsil, it starts swelling along the soft palate, or you get a shift in your uvula, the dangly thing in the back of your throat, then that's something that you definitely need to go to the ER for. Typically, we're draining those and then giving you a nice broad spectrum antibiotic. Now, again, there are other things that can cause a sore throat. You can just have drainage from a sinus infection. You could have a viral infection, like viral tonsillitis, that can cause some of these issues. Not everything is strep, and typically your body can recover from just about everything given the right measures. So what are those measures? 1, a good diet. Drink your water. Make sure you're getting some vitamin C in your diet. Anything with salt will help your throat feel better. So chicken noodle soups, Gatorade, saltwater gargles, and of course Tylenol and ibuprofen as appropriate. Remember, sometimes fever is a good thing. The fever is the body's response to kill off bacteria. Now, if it's getting really high or you have a risk of seizures or something like that, different story. Use some judgment there. But a low-grade fever is just the body trying to rid the bacteria. So if you have any questions, give me a call, 812-290-2128.